Now let's check on the situation at the Philippine General Hospital. Joining us live via Zoom is PGH Spokesperson Dr. Jonas del Rosario. Doctor, good morning. Welcome to New Day. We've spoken to you over the past several weeks, and we'd like to catch up with you. What is the situation now like at your hospital, PGH?
Good morning, Ria. Thank you for having me. We are seeing a steady increase in our admissions. I think the last time we talked, I was at the level of the numbers were about 140 to 160. Now our current admissions, the patients who are confirmed COVID are admitted in PGH, is 177. And we have a few patients in the emergency room waiting to be admitted. And there are some who are still in the other hospitals also waiting to be admitted to PGH. The problem is our ICUs are full. So it's not easy to get some of these severely or critically ill patients coming from other places. Some of our rooms or some of the wards have been transformed into an ICU setting because many of our patients who are severely or critically ill will require either a ventilator or a high-flow oxygen.
Right. Doctor, I know that your hospital sends samples to the Philippine Genome Center for sequencing. What percentage of your samples are coming back as the new variant?
Yeah, it's quite alarming. Last week, our samples yielded 3 out of the 30 samples yielded that it is from the variant. So it's still predominantly from the usual variant that we see. But just yesterday, we were informed by the Department of Health that out of the 29 samples that were sent from PGH, which are samples taken from our patients and our healthcare workers who are also infected, 23 out of the 29 are either from the UK or the South African variant, which is pretty much almost close to 80% now.
Were you surprised by this, Doctor?
Well, not really, because I think it's a reflection of how fast the transmission is happening. Because we were thinking really probably aside from some of the factors which were already pointed out, people not really following the minimum health protocols. I think one of the main drivers for these increased numbers is the variants. And so now we are just seeing that it's true. And now that people are coming in more and more to different hospitals, a lot of them probably have the UK or the South African variants already.
Dr. Jonas, OCTA has said that, by possibly next week, all of the ICU beds in Metro Manila will be completely occupied. Do you agree with this projection?
I think that is very possible. PGH, our ICUs have been full for the past 7 or 10 days already. We're trying to recreate some of our rooms to make them like ICU ready. But I can imagine also, depending on the allocation of a hospital in terms of ICU, I think that's very possible. A lot of the ICUs will be full. I know a lot of the major medical centers, the private ones, are already full because we are seeing some of these patients trying to get into PGH.
Lastly, Doctor, when it comes to regular beds, non-ICU beds for COVID patients, you said you're at about 177 now. If I remember right, you said your capacity for COVID patients is at about 200. How long before you will have to turn away COVID patients?
Well, the first thing that we just did a couple of days ago is reopen another ward. So now from 200, we will have about 230 beds now for our patients. So we won't turn down patients yet, but these are mostly service patients. The ward that we open is for charity patients. There is a pay hospital in PGH, about 3 floors, taking care of COVID patients also. But these pay beds are full already, brought about by a lot of these patients coming from or were turned down by other private hospitals. So we increased our number to 230, which is pretty much what we had during the height of pandemic sometime in the middle of 2020.
All right, hopefully you will never have to turn away any patients. Thank you for your time this morning. Philippine General Hospital spokesperson, Dr. Jonas del Rosario.